Welcome to Health Strategy TV. Today I have with me James Kingsland from the Department of Health. Welcome, James.
Thanks.
There's been quite a few different reports in the press about the way that GPs' response to the Act and the way they want to or don't want to become involved in commissioning. How's that looking now the Act of Parliament has been passed, and do you think that GPs are really wholeheartedly up for this?
Well, I think, and I'm on fairly safe ground as a practicing GP myself, is that the response to any change in our NHS is varied. In the 23 years I started in practice in '89, we created the internal market in 1990, and I've had the white knuckle ride since on the roller coaster of change. So there's always going to be a varied response. I think the concern is that the response is to accurate information. Some are welcoming it, and I'm seeing more and more general practitioners, once they understand the need for this reform and how it affects care or the ability to change care, more and more getting engaged. There are some have understandable concerns, and any change does bring that sort of concern in. But we're seeing an ever-increasing appetite to get involved.
Do you think GPs are ready to take on the commissioning role, given the fact that they need skills and competencies in that specific area?
Yes, I do, because commissioning, as we know, is a range of activities, and clinical commissioning is focusing on the very activity that deploys NHS resources and in effect is a commissioning act. GPs would recognise that as writing a prescription, making a referral. A referral would be an assessment of an individual's need and securing the best service against that need. So that's where we want the majority of clinicians to get involved, in understanding that an alignment between their clinical decisions and the resources that are utilised as a result is part of the programme. The aspects of commissioning that leads into contract management or procuring a service against that need, we don't expect or would wish to see lots and lots of clinicians involved in that aspect. There will be some who are already skilled through their previous experience with SHAs or PCTs. Some will wish to develop those skills in the areas of commissioning which we've often struggled with, i.e. procuring new service for our NHS and managing contracts, payment by results, and getting the best value for NHS funds. But the majority of clinicians, whether they like it or not, are involved anyway by the very nature of their day-to-day activity, and that's what we want to capture, hone, and make more specific to day-to-day practice.
Do you think GPs are concerned about the scale of budgets they're now going to have to be responsible for? We're talking about budgets in the multi-millions of pounds locally, possibly in excess of 100 million in many localities.
For the ultimate accountability of the large budgets, we're talking about the governing body of a CCG, one accountable officer, which there is the hope that more and more of those will be clinicians, a chair and a governing body which will take the accountability of the overall spend for the CCG. But again, going back to the individual practice, will be committing resources and has been every day of their working lives. So it is just focusing, not producing anything that says this is a new way of working. It's a new accountability arrangement within general practice that needs to be understood. And possibly when people talk about why we needed this huge piece of legislation, one of the key aspects of the legislation is for accountability, and it is aligning clinical decisions with the accountability for the resources that are used as a result of those decisions.